we've been working with person under cancer treatment for quite a few years, and I wanted to develop that and to tell everybody, every shiatsu practitioner, you can do it, it's great. A lot of persons want this kind of treatments, shiatsu treatments for cancer. I thought, well, it's free. I'm going to give them free time. Shiatsu is great. They're going to welcome me with open arms, you know. And no, it wasn't like that. I had an interview, like a job interview, even it's volunteer work, with two persons in front of me, you know. I had made my CV, a bit of different documents, and they told me, why shiatsu? Why shiatsu is that great? Because we already have reflexology. Yeah. So I had to find some arguments, you know, about how shiatsu is great too. And so I told them that shiatsu can be, it's on the whole body, as you know, and that it's important because you can teach the partner of the person who has cancer. You can teach them some points they can do to themselves like self-shiatsu, but you also can teach that to the persons that are close to the patient. And that's what was really interesting for them, because in France, they saw that the patient and there are the people around her or him, and there's nothing for them, for the supportive persons. So it was good for them. I said, yes, I can teach them so they can do something for their mother, their daughter. They can do something that is working, you know, for the chemotherapy, or to help decompress, to help go to sleep, etc. So that's how I got it, and I came into the League of Cancer.
What you're talking about there, I think, is empowerment. And this is a key word, I think, in shiatsu. We try really to embody the force of empowerment. It's not just giving people a plaster over their ache or their pain. It's not a pill to correct something and then it will come back.
But in French, we say se prendre en main, to take you by the hand, to take yourself and to do it. And it's really interesting because I always give the person I receive for shiatsu treatment, I always give them a Pionex or, you know, something for the nausea, and do it, you can do it. And if they are too tired to do it, too exhausted, because sometimes it's the case, they can tell their husband to do the points, you know, and it really changes the way of them seeing their symptoms, because they know they can do something. In a lot of shiatsu schools, you told the students, you don't give shiatsu to a person under cancer treatments. So a lot of shiatsu practitioners thinks it's forbidden. We have to work about that, because there are a lot of persons who can leave they can live for a long time after receiving the good treatments. Well, I think that's why such a few shiatsu practitioners aren't trained and don't do that. And it's a shame, because it works really, really well. We meet the oncologists, we can meet the nurses, etc. So you have to, you know, empower yourself, because you're going to talk to an oncologist, so you're afraid at first. But I told them about what I'm doing, and actually I talked about the name of the patient I have, and sometimes it was the same, and they told me, oh, that's you, but the patient showed me a point that is good for hot flashes. Can you show me the point, because I have hot flashes. So when I hear that, I'm like, yes, shiatsu wins. I told them, if you want, you can come with your husband, with your wife, with your children, and I can teach them some things for you so they can do it for you. It works really well for couples, of course, because, well, I have a lot of persons with breast cancer, so my clientele is mostly feminine, and people are mostly heterosexual. So I have a lot of men coming that don't know what to do, but they want to help. They're very afraid to increase the pain. So I have to just told them, there's no problem, no contraindication. You can do it, press just like that. And I do the gesture, they do it. And so he takes her hand, he's pressing the point, they look at each other, they're smiling. And I'm like, I think it's really important to work on the communication and the possibility to go to see the oncologist, go see the nurses, go see the doctors, and make yourself be seen as a shiatsu practitioner who is working with treatment of cancer. So shiatsu can really be in the supportive care around cancer. And now I think the Occidental medicine see that it's important to have supportive care to take care of the side effects, because if you take care of the side effects, you can give the full dose of chemotherapy, the full treatment. They see that it's really important to have this kind of supportive care, different one, psychologists, sophrology, etc., and shiatsu. So I think it's our job to tell everybody in the world that shiatsu is a great supportive care, and to really to have this in mind, not to say shiatsu is going to cure cancer, because of course, if you know how to do it, please tell me, but to be able to support the person, to support the treatment's rhythm.
One of the aspects of this story is don't be afraid to go out there and speak to a few people about what shiatsu can do.
Yes, and don't be afraid to give shiatsu. Don't be afraid. Because, you know, it's easier to reduce pain. Someone has a pain of 8 to 10, you know, you say to them 10 is the most painful pain you can imagine, 0, you don't feel anything. And then when they have 8, you can reduce them easily to 4. But when someone is only 2, it's very difficult to reduce it to 0. So really working with shiatsu cancer, it's good for you too, because people are like, oh, it's working, it's so great. So it's really a nice experience.